Thank you, Miriam. And I'd like to extend thanks also to the Improbata team as a whole for providing this opportunity to be with you here today. As Miriam said, my name is Sarah Wiles, and I serve as the Vice President of Business Development at Summit Healthcare. And joining me is Eric Talberg, Product Manager for Summit Healthcare. And we'll be guiding you through today's discussion as it relates to the role and the impact that clinical event notification can have in your interoperability, data communication, and data exchange goals. As a whole, we're going to talk through first, just giving you a high-level, very brief introduction to Summit Healthcare, who we are and what we do. But we're really going to be stepping through the role of electronic clinical event notification in today's industry. To that end, we're going to speak in great detail as it relates to some of the industry drivers compelling clinical event notification adoption and consideration for adoption and deployment. This includes reviewing the importance of different electronic clinical event notification modalities. There's certainly different care stakeholders throughout the organization or an accountable care organization that may need different pathways for communication. And ultimately, we're going to wrap things up by providing a brief demonstration of provider alert technology. And then as closure, we'll leave a little time at the end to wrap up, as well as provide a little time for questions and answers. To that end, for those of you who are not familiar with Summit Healthcare is an integration as well as automation provider servicing the healthcare industry since 1999. Our mission is really to be a leader in interoperability and automation technology and solution and service delivery to our customers internationally and nationally. Well, with that said, let's start talking a little bit regarding the role of clinical event notification in today's industry. Really, over the past 10 years, healthcare has rapidly undergone a technology and interoperability evolution to support quality, performance, patient safety improvements, and reimbursement goals. As a whole, it's becoming more and more essential for organizations, providers, subacute communities, to proactively share data and communicate patient clinical events to care stakeholders, both in and out of network, in order to support their transitions of care, patient safety, and quality of care goals. But just as important as simply sharing that information is the timing of when this information is exchanged and communicated, as the timing can have a significant impact on an organization's performance goals. According to the Agency of Healthcare Research and Quality, electronic real-time, electronic event-based notifications are a simple yet significant strategy and are of critical importance to improving the quality of care delivery being provided within our industry. That's because U.S. healthcare has had some significant and troubling patterns that can continue to persist, but could be easily remedied with automatic electronic data exchange and notifications playing a critical role. Some of the statistics include, according to the Office of National Coordinator for Healthcare IT, less than 40% of hospitals routinely electronically notify a PCP when their patient presents at the ED. But when the PCP is outside the health system, only 1 in 3 hospitals are notifying the PCP. Furthermore, a Commonwealth Fund study comparing care coordination finds that less than 30% of family providers in the U.S. are always notified when a patient is seen in the ED or discharged from the hospital. And then the report goes on to conclude that U.S. physicians are amongst the least prepared to manage conditions associated with aging outside of the hospital or the nursing home setting based on this disconnect or lack of communication. And this is substantial, particularly when one considers that the rate of timely follow-up by primary care providers is less than 47%. That is within that 30-day post-hospitalization transition. And that's according to the Journal of Medicine. And patients lacking that timely PCP follow-up are the patients that are 10 times more likely to be readmitted to an organization, or as a whole, nearly 1 in 5 patients are being readmitted in 30 days, and as much as $25 billion is being spent annually on some of these avoidable readmissions. Needless to say, while the industry has made tremendous strides in technology adoption over the past few years, a problem still persists in today's system. The increase in specialization of care means that patients are finding themselves being cared for by a disconnected or a fragmented arrangement of unrelated providers who are loosely linked by either an inadequate means of communication and an inadequate means of information exchange. And the lack in proactive documentation sharing, or the lack of communication or sparse integration framework, really leads to primary care providers and care teams not being aware of patient hospitalizations or discharge in order to promptly follow up. Even with technology gains over the years, it can be cumbersome for care teams, which span multiple organizations, systems, technical capabilities to exchange the information and monitor conformance. And yet, it's of critical importance because providers and care stakeholders need to be able to review test results, summary of care, supplemental care information following such events. And as a whole, more and more studies are showing that the failure to inform primary care physicians of a patient's treatment and other coordination deficiencies are the major drivers of poor health outcomes, preventable hospital admissions and readmissions, and of the escalating cost of health care. Therefore, the disconnect between these care settings is ultimately counterproductive toward the overall goal of healthcare reform. But there are a number of industry drivers which are really compelling hospitals, providers, and care teams to improve how they're sharing patient information and communicating in support of transitions of care, but just as importantly, when they're communicating and sharing information in support of transitions of care. Some of the catalysts are regulatorily driven, others are based on changes to reimbursement models, and then there are those day-to-day cost realities we've all experienced in the market. But from a regulation perspective, the government has really worked to institute policy which fosters an environment that incents proactive, collaborative, cross-care communication and coordination, because particularly post-discharge, it's been found that those patients lacking the timely follow-up are the ones most likely to be seen within the hospital. The Affordable Care Act has really created incentives and now penalties, along with requirements for hospitals to implement substantial transition of care processes to reduce preventable readmission rates, which are tied back to those drivers of overall cost of care. And then in 2012, CMS began instituting penalties for hospitals with high readmission rates within 30 days of discharge for a number of conditions. And the number of conditions and rate of penalties have increased steadily over the years. Therefore, in order to help prevent readmissions of patients with these conditions, proactive notifications, communication, document exchange, and care coordination are really paramount. In order to further reinforce the importance of cross-care communication, compliance with CMS Regulation A0133 has also been introduced. And that ultimately states that the patient has the right to have a family member, a representative, and their own physician notified promptly of his or her admission to the hospital. So the responsibilities of the organization are to provide that prompt notification, to have formal policies and procedures in place, and to ultimately document in their medical record that the notification has in fact occurred. Therefore, electronic clinical event notifications can really help organizations automatically maintain that regulatory compliance by automatically providing that inherent communication. And then additionally, CMS has provided extra incentives to providers to proactively engage post-acute care. Specifically, CMS really wants outpatient providers to focus on safe transitions and has reinforced that point by introducing new transitional care management reimbursement codes. Therefore, providers may bill for care transition services if they see patients within a certain specified period of time, 7 to 14 days of discharge from a hospital or a skilled nursing facility or rehabilitation facility. Therefore, it's in the best interest of providers to subscribe to proactive notifications and communications from area hospitals, because the sooner they're aware of an event, the sooner then they can follow up. And while a few of the industry catalysts for electronic notifications and data exchange adoption are driven by regulation, none are probably more impactful than the transition to value-based reimbursement models within the healthcare industry. The gradual evolution of payment models to pay for performance are really compelling organizations to evaluate how and when to communicate, coordinate, collaborate, and how and when to share information to ensure they're supporting quality initiatives and maximizing reimbursement. New payment models, including bundle payments and shared savings programs for accountable care organizations, have really created incentives to coordinate transitions and provide care in less intensive settings. Although the accountable care concept is still evolving, already 1 in 8 Americans get their care from one of more than 700 ACOs nationwide. And unlike HMO enrollees, ACO patients have the choice of seeing doctors outside the organization, which places an additional challenge and responsibility on hospitals regarding when and how they're sharing information with providers. The financial model, obviously, of an ACO really incents people to know and want to know what's going on. And essentially, the fundamental aspect of an ACO is the doctor needing to know what's occurring within the hospital and what's happening with the patient at the literal computer level. So doctors can not just be aware of events, but with detailed supporting data can scan those patients and pinpoint who may need that interventional care for follow-up. And then finally, in order to control costs, healthcare organizations with value-based contracts absolutely need to actively manage the post-acute care communication and coordination. Specifically with HCAHPS dimensions in 2017 and 2018 transitioning to include care transitions criteria, organizations need to continue to invest in the processes and technology to support automatic electronic notifications, and document sharing in order to support effective care transitions of high-risk, high-cost patients in order to maximize the reimbursements under a value-based purchasing model. Apart from the compliance and the reimbursement drivers, there are also those day-to-day practical cost realities that health systems face when sharing data and communicating with area providers, especially when they're doing so using legacy approaches, be it faxing or phone calls or even point-to-point interfacing, which can be mitigated through an automated and electronic approach. The industry has really made great strides over the years with EHR technology adoption to help augment when and how information is being shared, and yet according to the Journal of Healthcare Information Management, the healthcare industry is still processing over 30 billion healthcare transactions each year, which is costing the healthcare industry $250 billion to process, and over 15 billion of these are transactions through faxing alone. And unfortunately, communicating with internal or external providers using legacy technology is simply costly and inefficient due to poor latency, missing information, or security risks of PHI exposure, which ultimately costs patients, hospitals, and doctors time, money, and sometimes lives. While widespread adoption of electronic business transactions in healthcare continues to grow, there still remains a significant opportunity for upwards of $9.4 billion in annual savings remaining, according to a new industry report from the Council of Affordable Quality Healthcare. And conducting resource-intensive manual transactions are really costing U.S. healthcare providers as much as anywhere from $6 to $11 more per transaction. So there's significant opportunity for cost savings when transitioning to an electronic clinical event notification process in order to support that communication between organizations. And while there are also those day-to-day practical cost realities health systems face, the impact on providers is just as significant. There's new findings showing that medical providers could save at least 1.1 million labor hours per week by transitioning to fully electronic transactions. Right now, providers are spending on average 8 minutes or 30 minutes a day on manual tasks. And that could be making phone calls back to a hospital, to a medical records department, sending faxes, even mailing correspondences. So as a whole, the value of conducting business electronically creates greater efficiencies and greater cost savings that can be realized through seamless data communication and data exchange. And when hospitals, HIM departments, and providers can reduce the amount of paperwork called for or waited on, then more time and resources can be spent delivering timely follow-up care for patients. Finally, an important consideration of electronic clinical event notifications and documentation exchange adoption is it really built around the need for solid strategies to support care transition processes with the goal of supporting readmission reduction initiatives. Whether patients are transferred to post-acute facilities or to their homes following discharge, too often processes or communication failures within healthcare systems can lead to avoidable readmissions. During care transitions, for instance, communication delays or gaps in data availability can and frequently do occur when patients are moving beyond a hospital's four walls or beyond an organization's immediate care network. Frequent causes of preventable readmissions include delays in communication, failures in communication and documentation access, delays in scheduling post-hospitalization care, and medication discrepancies. This is even more alarming as nearly 80% of serious medical errors are attributed to miscommunications during patient transfers or handoffs, or lack of communication and data sharing, which illustrates the critical need for effective, accurate, automatic, and timely information exchange of information, not just at discharge, but at the point in time that that patient is presenting. To that end, an overwhelming body of research really outlines the best practices to support transitions of care and reduce readmissions, and it reinforces the need for prompt communication and data availability to providers, timely communication and data sharing at handoff, early post-acute follow-up, early post-discharge phone calls, improved transfer processes between facilities, and proactive and effective medication management. Therefore, leveraging electronic communications and data exchange technology can play an important role in inherently, seamlessly, and automatically supporting that timely handoff and improved transfer between facilities by electronically providing a comprehensive snapshot of care, and by supporting early post-acute follow-up. The timelier the communication at that point of presentation, the faster a primary care provider, whether they're in your immediate network or not, can get involved in the post-hospitalization care follow-up. To that end, with more and more studies showing that a failure to inform providers of a patient's treatment contribute to poor health outcomes, preventable hospital admissions and readmissions, and of the overall escalating cost of healthcare, preemptive, timely, flexible communication and data sharing to care teams can have a significant impact on an organization's outcome and bottom line. So the ideal solution to this problem really offers providers throughout your continuum of care a simple, efficient, seamless way to be made aware of clinical events. It provides timely access to clinical event data that includes notifying a provider or other care stakeholders when that patient is presenting, but also securely providing comprehensive information regarding the episode of care. The ideal solution is web and or mobile-based and is complementary to a care team's workflow. Providers obviously are rarely at their desks, and yet their support teams, but be it admins, schedulers, coordinators may be. So a tool set really needs to be flexible to each team member's needs. And it must be easy to use with robust searching and filtering capabilities. I think we've all experienced the different levels of technical aptitude and access throughout the care continuum. Therefore, ease of use is of critical importance to maximize adoption and expedite the learning curve associated with each end user. To that end, Summit's Provider Alert Platform can support each of those needs while addressing the fundamental goal of facilitating automatic electronic notifications and data exchange with your in-network and out-of-network providers. It's a web-based application which delivers real-time, patient-specific clinical event data to your defined, subscribed care team, be it providers, care managers, practice managers, payers, and even to your subacute communities, regardless if electronic health record technology is in place or not. The goal is to ultimately put actionable information in the hands of the right care team in order to promote coordination, collaboration, and follow-up to seamlessly care for the patient and ultimately mitigate the risk of them being readmitted. The Summit Alert platform is really an all-encompassing centralized platform which can leverage integration and an event-based triggers to inherently initiate electronic communication. It provides a rules-based engine to intelligently parse data from events, route events to subscribed and authorized personnel, and deliver notifications and patient data to the appropriate output. Therefore, with our comprehensive platform, your organization is able to have complete, secure control over the when of communication, the what of communication, and the who of the communication, and ultimately the where. From the who perspective, with our comprehensive rules engine combined with subscription-based access, an organization has full control over which providers, practices, long-term care providers, care managers, or even managed care providers and payers that you communicate this information to. In terms of the when, you can determine how soon a provider is notified. Is it at the point of ED presentation, at the point of transfer and or discharge, or is a daily summary of events presented? But the sooner a subscribed provider is notified and provided information, obviously the more quickly they can follow up. In terms of the what, by leveraging industry interoperability standards, you can provide the event notifications which detail which sends details regarding chief complaint or diagnosis, but you can further supplement the information being made available. So this really goes beyond simply sharing a CCD, as providers are often asking for more details around an episode of care. So instead, you can also provide enhanced hospital documentation, physician documentation such as H&Ps, lab and radiology resulting, and face sheets. And then in terms of the how, for each care team member you want to communicate with, there has to be flexibility in how individuals can access that information. While other clinical event notification providers may provide one output, the Provider Alert platform really supports a variety of modalities in terms of communicating information to, be it through inherent EMR integration, through notifications, including secure messaging with Imprivata Cortex, or through the Provider Alert web desktop. When looking to accomplish mobile, secure, scalable communication to support clinical event notification messaging to your care providers, Imprivata Cortex can support your secure messaging and ultimately care coordination goals. With Imprivata Secure Communication Platform, your organization can enable secure communication for doctors and nurses or other care stakeholders, and they can receive these notifications across their smartphone, their tablet, or workstation, both in and outside the four walls of the hospital. With Imprivata's Cortex is deployed in a Provider Alert environment, subscribed providers can automatically receive clinical event notifications as well as report and result notifications, arming them with timely, pertinent details specific to their patients. So before I pass controls over to Eric for a brief technology demonstration, I just wanted to take us through two different use cases as it relates to the Provider Alert and communication integration workflows. The first being a use case for a provider. For instance, if Dr. Carson may want to subscribe to receive hospital admission as well as discharge notifications for patients within her patient-centered medical home. Under that circumstance, Dr. Carson would use Provider Alert to subscribe to electronic events and will ultimately determine the modality by which she prefers to be notified and receiving any follow-up information. So considering that Dr. Carson is very mobile, very active, rarely in her office, she might set her preference and subscribe to receive a direct secure message through Imprivata Cortex, which in turn she could also receive additional information through the Provider Alert web desktop. So Dr. Carson subscribes to receive notifications through secure messaging. Then when a patient presents, say with COPD, and is admitted to an organization in the ED, when discharged from that hospital, that she will be notified promptly by secure message through Imprivata Cortex upon ED presentation and again upon patient discharge. This notification would take place real time and is initiated by the completion of a registration that's taking place within the hospital. And with that ADT integration being leveraged and read in order to determine when and ultimately who to notify, and when and ultimately who should receive additional episode of care documentation, which we'll review within the Provider Alert desktop. The second workflow that we're going to review really is specific to other care stakeholders. This might be a practice manager or office staff member who is supporting a provider in terms of scheduling any follow-up care. The Provider Alert web desktop is an access point for providers, care managers, or other authorized stakeholders to view comprehensive details of patient event information and to automatically electronically receive this information from the hospital without having to call medical records, wait for faxes, or otherwise hunt down information on a particular patient. So Dr. Carson or Dr. Carson's staff is able to review a patient work list and a patient event detail, which could include those face sheets, those H&Ps, CCDs, any additional supplemental resulting in reporting information, as well as discharge summaries. So this ultimately ends up being a win for hospital medical records department, as it provides access and security to affiliated and non-affiliated providers without having to give them full EHR access rights. And it's a win for providers because they have that timely access to information in order to proactively coordinate follow-up in a very timely manner. And ultimately, that leads to it being a win for their patients as well. So with that said, I'd like to go ahead and take this time to pass controls over to Eric Talberg, who's going to be giving us a brief demonstration of the Imprivata Cortex technology as well as Provider Alert.
And thank you, Sarah. Good morning and good afternoon, everybody. This is Eric Talberg. I am the product manager here at Summit Healthcare. And what I'd like to do today is to sort of give you a demonstration on what Sarah was just talking about, where a provider, Dr. Carson, would like to receive notification upon the admission of one of her patients. In this case, it's going to be a patient, a 52-year-old woman who is going to be admitted to the hospital and, again, notify Dr. Carson immediately. And what will end up happening is that as soon as that admission is completed, it's basically an ADT message that's created within the hospital system, and it's sent through the online system. You'll get a notification immediately upon that patient arriving, all right? And on my cell phone, you'll see that I get a number 1 in my Cortex. I can then open that message up from my cell phone, and I can actually see that Sarah Donahue was admitted to the hospital just now, and for the particular reason. And again, we're using Imprivata Cortex because this is a secure text messaging system that's going to allow Dr. Carson to be able to view pertinent information about this patient at the time of the admission. Now, another user that may want to have access to this might be a care manager, or it may be the practice manager who has the desktop version of the Imprivata Cortex as well. And as you can see, the same message came across on the web version of the Cortex, and we're able to link directly to our product, which is the Summit Provider Alert product, directly linking it in. We'll log into the system, and we'll have sort of an initial desktop by which we can analyze what's going on within the practice with certain patients that have come in and other pertinent information for that practice manager. More importantly, though, we can then look for information pertaining to Sarah's admission, and we can look at the specific patient, and if they had more than one visit, we would see more than one visit available to us here. And within that visit, we're going to then have access to the hospital's data. These are all the reports, face sheets, whatnot that we can now provide to that provider through the web application. Again, this is being hosted by a central hospital or ACO to where the patient has been admitted, documentation has been created within the hospital system, and I am now gaining access to the system. And I can actually look at the phase sheet from, looks like March 16th, and we can look at why they came in. We can go back and look at other documents as well. And the nice thing about this too is we can see that there are multiple reports in here. So if I open up a progress note and I decide, you know what, I want somebody else to be able to view this document, I can actually share this document with someone else. Okay, I can just put an email address in, and what's going to end up happening is the system is going to develop a link specific to only that email account, and that provider will then have 24 hours access to that same document. And again, this document was created at a centralized location, usually at a hospital. My system, my Dr. Carson's system, gave me access to this, and now I just gave access to maybe a specialist to be able to review this exact document as well. So what this is basically a self-service kiosk where you can actually create your own access to a hospital, or you can request access anyway. And we'll say at the hospital, their medical record staff is usually the ones that are going to verify the users that are requesting an account, or maybe the hospital will verify the office manager for a doctor's office, and then that office manager can then authorize new users to that office. All right, so there's 3 levels of users. There's regular users, there's the office staff administrator, and then the hospital staff administrator, which is sort of at the top of everything, sort of making sure they know what's going on within the system. Once I get into the system, I can put pertinent information in there, with email address, Imprivata's information, and then I can also create my own alerts. Okay, what do I want to alert? I want to alert on certain events, and I want to alert on certain specific locations, okay? And in this case, I only want to alert when I go into the emergency room. And I can create a new alert, and it's a real simple process by which you can determine where you want to go or what messages you want to receive and how you want to receive them. So bring the new alert, create the alert, and we'll have templates set up so you can determine that I want specific locations. Maybe I only want the emergency room. I can select only that, or I could have all of them selected as well. And this allows the individual providers, the individual users to determine specifically what they want to be alerted upon. In this case, I only wanted emergency department admissions, or it could say, anytime they go to the ICU or anywhere else for that matter. And then how do I want to be alerted? Okay, some users may want to use the Imprivata CoreText. Others may have a direct email address, work phone, email, but they can determine how they want to be admitted. So there's going to be templates you can create to determine specific events that you want to be notified on, and then how you want to be notified. And that's the basics of how the system works. Real quick, to go back to the Home tab, this is the view that the administrators will have. And again, what this is providing is just information on how many new patients have arrived at the facility, new account requests, group requests, new patient admits. There's all sorts of information here that the administrator would want to know about in terms of new patients coming in, or if information has been accessed by outside providers. All right, so that's the basics of how the system works. And with that, I'm going to go ahead and invite Sarah back into the conversation and see if we have any questions.
Thank you, Eric. I just have maybe one more slide to get through, and then we'll go ahead and open up the floor for questions. So ultimately, we just wanted to close things out by talking through some of the implications and benefits of electronic notifications for an organization. First and foremost, there's a significant impact as it relates to provider productivity and efficiency. When you're providing automatic electronically notifying and sharing data with providers, it can help those both in and out of network providers mobilize timely follow-up. So that's whether it's scheduling appointment, aftercare, ensuring the patient understands discharge instructions and education, or conducting medication reconciliation. So Provider Alert within Imprivata Cortex can really fill the communication gap, enabling providers to better manage and monitor their patients. It can really help an organization optimize reimbursements. As we know, providers will be eligible for submission of new transition of care codes. CMS has encouraged outpatient providers to focus on those safe transitions through those new reimbursement codes. So it presents a great revenue and reimbursement opportunity for providers. It also presents a great opportunity in terms of enhancing provider relationships throughout your community. And this specifically, it can be drawn back and cited or pointed to the Journal of General Internal Medicine that states that one of the #1 frustrations in physician group focus is not knowing when a patient was at a hospital or in an organization. And #2, it's not having information about the hospitalization. So when you combine the power of the Provider Alert platform with Imprivata Cortex, you're really addressing that complete awareness as well as data availability in a seamless manner. And finally, organizations can really manage and minimize penalties that they may be seeing from a reimbursement perspective. Again, as we reviewed earlier today, CMS has instituted penalties for facilities with high readmission rates within 30 days of discharge for now up to 5 conditions. So this is a great opportunity in terms of fostering further communication amongst your provider community with providers outside of your community to work in concert with them in that post-acute care coordination and collaboration process by automatically notifying when those patients are presenting, and then likewise by automatically providing secure electronic supplemental episode of care information to them in order to really empower them with timely follow-up. So with that said, I'd like to take this moment to thank everybody for joining us today. If you have any questions, I would please encourage you to go ahead and don't hesitate to reach out directly to Summit Healthcare or at the email address listed below. But with that said, I'll go ahead and pass the floor back over to Miriam with Imprivata. Miriam?
Thanks so much, Sarah, and thank you to both you and Eric for a great presentation. I do want to, we did actually have a few questions come in that I want to address now before we close out. The first question we received is, how do I know I'm getting notified of the accurate patient? So, for instance, if it's Nancy Lopez from Plano, Texas versus Nancy Lopez from Valencia, California.
That's a great question. So the rules engine that Summit uses is it's going to utilize more than just the name and address. It's going to use the whole ADT message to be able to verify which patient it is that we're going to be displaying. Doctors are going to provide to the hospital that's hosting the system their patient list with all their demographics. And so those demographics are going to match up to ADT messages or whatever other messages that are going through the system. And we're especially sure that the correct information is being displayed.
Okay, great. Thanks. We do have a couple more here. The next question I have is this a provider-specific solution?
Eric, I can take that one.
Okay.
And that's a great question. Thank you, Miriam, for that. The design is really intended to allow anybody in the care team to be notified, assuming that they are subscribed and an authorized user. So be it a provider, a nurse team member, a care manager, they could, as subscribed users, when they've identified the modality by which that they choose to be notified, they can be notified by Cortex on their iPhone, or they could receive additional supplemental information regarding that episode of care through the Provider Alert web desktop. So for example, if, and this is really meaningful, particularly when you start looking at the growth of accountable care organizations throughout the industry and the need for collaborative and coordinated care. If a patient with a congestive heart failure is admitted and then discharged from a hospital, a PCP could be notified promptly upon patient presentation and discharge and electronically provided pertinent episode of care documentation. Whereas a care manager could also be notified when the individual is admitted and provided care reports, results, documentation, allowing them to monitor care during the course of the hospital stay and coordinate with multiple providers when that patient is discharged. And then there's also power in payers receiving notifications, particularly pursuant to member consent, so that if an insurer's in-house clinical staff can respond by providing essential information to care providers, such as hospital discharge planners, hospital medical staff, and on occasion, the private medical doctor's office. So this can really help cue payers to look into discharge activity, and if needed, help coordinate follow-up care services and support of readmission, reduction, and cost control initiatives. So most definitely, there's a use case for virtually every care stakeholder out there.
Excellent, thanks. The next question we have is, how does a subscribed authorized user receive patient event data, and what data is available?
Well, that's a good question, too. So the data that's available, we saw a pretty good list of documents that we had available for our sample patients for Sarah Donahue. Really what we're doing is we are analyzing the engine, so the integrations engine that's receiving HL7 messages, whether it's ADT, results, etc. And we're able to convert those into FHIR objects. And we can then send that to our viewer, which then utilizes style sheets to be able to present that data in a more meaningful manner. They'll be able to read it like a human, they can print it off, and they'll also be able to share that data as we saw as well.
Great. And also, are notifications real-time?
Yes. As soon as that ADT message hits the engine, it is immediately being transmitted. So when we receive the ADT AO4 message specifically, the system recognized that as an event of a patient registering. It also had the emergency department within the message, and it sent it immediately out to the Cortex engine, which then notified us via the phone and then also on the web application as well.
Great, thank you so much. So that is actually it for the questions, and I do want to say thank you again to both Sarah and Eric for joining us today and for presenting on this topic. And there is a final note before we all go. If you do have any questions about what you've seen or heard here today and would like to request a demo, you can email me right here at the address that you see on the screen. Again, my name is Miriam Lizardo, and I'll be sure to get someone in touch with you within 24 hours to answer your questions. So finally, as a reminder, today's session will be recorded or has been recorded and will be sent to all registrants in the next 2 business days. So thanks again to everyone for joining us today, and this concludes today's webinar. Thanks.